We get started, we always want to thank our sponsors, Erin. How about if we put them
Absolutely.
front and center?
Absolutely. We could not continue to bring you our monthly digital education events, everything that we are providing to you without the help of our sponsors. So this evening's virtual hangout is presented by West, Merck, and Daiichi Sankyo, with additional support from Lilly, GSK, Gilead Sciences, Pfizer, and Immunogen, now part of AbbVie. So we are just so grateful for their ongoing support of our education platform.
So, Nicole Dreibelbis is a women's health nurse practitioner who has been practicing in the gynecologic oncology space for 8 years. Her special interests include healthcare equity, gynecological malignancies, and sexual well being in oncology patients. In April of 2023, Nicole started the first Regions Oncology Sexual Health Clinic for vulva owning patients and is currently caring for patients in Harrisburg, Mechanicsburg, Newport, and York. Nicole is passionate about educating both patients and providers on the importance of sexual health, and she is heavily involved in the Society for Gynecological Oncology, which is where we met you, Nicole, and is also a member of the International Society for the Study of Women's Sexual Health. Please join me in welcoming our guest tonight, Nicole Dreibelbis. Great.
Hi, everybody. I'm Nicole Dreibelbis. I'm a women's health nurse practitioner. I have worked my entire nurse practitioner career in GYN oncology, so vulvar, vaginal, cervical, uterine, fallopian tube, and ovarian cancers. There are some gyn-oncs that do breast. We are not that group. I've been working in gyn-onc for 8.5 years in central Pennsylvania, and my friend Nora helped me put this presentation together, so that's why her name is on here as well. So we'll go through. There's a lot that I hope I can help spark some ideas and help make you all feel like you're not alone, and that there are things that you can do to improve the current status of your intimacy. Objectives for today are for attendees to be able to list 2 types of intimacy, explain the difference between sex, intimacy, and sexuality, because a lot of times the 3 of those words get used in the incorrect context because we're actually meaning something different. List 2 ways cancer and cancer treatment can impact sexuality and intimacy. Understand ways to improve intimacy in your relationship, and understand ways to improve pelvic pain. So first, what is intimacy? So I did what a lot of people do when they want to know what something is, and I put it in Google. So these are all of the pictures that came up from Google when you just put in intimacy. I didn't do any other qualifiers or any other wording. These are just some of the first couple of pictures that came up. So you can see the majority of them are, actually all of them are couples. And they all seem to be touching in some manner, intimate with each other, as in their own in each other's personal space a little bit, and that's part of what we're talking about here. But Webster also says that intimacy is a state of being familiar with someone, something of a personal or private nature. So some synonyms are like belonging, familiarity, chumminess, which made me laugh when I saw it, closeness. And then they give some examples of the intimacy of old friends, right? The intimacy you have with old friends is different than the intimacy you have with a sexual partner, but they're both intimacy in just different ways. So it depends on what source you are using. I found up to like 7 or 8 types of intimacy, and then I found as little as 3. I settled on 4 because these 4 made sense for me. So emotional intimacy, there's, cognitive intimacy, experiential intimacy, and then physical. So sexual falls under physical there, for obvious reasons, but it also actually kind of falls under emotional and cognitive as well, because it truly is, if we're talking about sexual intimacy, it truly is a combination of multiple types. So there are key factors needed in order to be able to develop intimacy with someone. Trust is one of the first things that is truly needed in order to be able to open up to somebody, let them be in your space, both physically and, emotionally in your space. You're more likely to be intimate with people you trust than people who maybe you are leery of or have maybe broken that trust. Acceptance. So the person that you want to have that connection with needs to accept you for who you are. If that's not a key, if that's not present, the intimacy probably won't be the healthiest. Honesty also kind of goes with trust and safety. All of these are pretty intertwined, but you can think about, your intimate relationships and how you feel about those people. I'm sure there are some that come to mind where you're like, I trust so and so because I know that no matter what I tell her, it doesn't leave the office. And maybe that's your office bestie. Compassion is also something that's really important for intimacy, especially true intimacy, because not everything is a straight line. Not every journey is, smooth sailing. Most aren't. And I'm sure you all know that because you're here. So having compassion for the other person really fuels intimacy as well. Affection, of course, is part of it, and it doesn't necessarily have to be physical affection. It can just be, hey, I don't know, I went out for coffee and I noticed that you didn't have any more, so I bought you a coffee while I was out. That's an affectionate thing that a coworker can do or a friend. So it doesn't necessarily have to be kissing, although that certainly counts. And then communication, and that is in capital letters for a reason. One thing I will say that has been a theme with most of my patients is we have sex education in school, and I put that in quotes because it's not really sex education. It is, here are your parts. And when they're talking about vulvar owners, they don't even mention the fact that they have a clitoris. That's not even a part of the conversation. So they talk about anatomy, they talk about function as far as reproductive function goes, and they talk about risks when it comes to, pregnancy and STIs, but nobody talks about pleasure and enjoyment of sex. And so we all grow up not knowing how to talk about sex because nobody talked to us about sex. Or at least most of us have that experience where nobody's talked to us about sex, and especially not how to enjoy it. So communication with your partner is huge. I have so many patients who come into my office and will say, my partner doesn't even know I'm here. Or, I've been having this pain and these same problems, but I don't tell him. I bite my tongue and I just ride through it. It's over really soon. And those things aren't okay. You need to be able to communicate with somebody, especially somebody that you want to have a more intimate relationship with. So this made me giggle a little bit. Let's not complicate our relationship by trying to communicate with each other. Between the two of them, I definitely think it was the man that said that. But you guys can all weigh in if you'd like to, as far as whether or not you agree with me. But for my husband, it would definitely be him saying that. So there are benefits to intimacy. Obviously, being intimate with somebody just feels nice. Having somebody you can trust, having somebody you can communicate openly with and know there's going to be acceptance and no judgment. So some of the benefits that have been well studied are increased sexual desire. The more trusting you feel of somebody, the more safe you feel with somebody, the more heard you feel with somebody. If your goal is to have a sexual relationship with them, that can increase your sexual desire. It can increase it increases relationship satisfaction. Again, it doesn't have to be a romantic relationship. It can be a friend, a coworker, anybody. Health benefits. It improves your immune function, lowers blood pressure, and lowers risk of heart disease. And those are all proven too. They've been studied for years and years. So it is truly a health benefit to be intimate with people. And it improves your mental health. Again, carrying the mental load that a lot of us carry is a lot. That's heavy. And so if you don't have anybody that you can trust to unload some of that on, or at least talk to somebody about, it can take a toll on your mental health. So having somebody that you trust in your corner is really beneficial. So when we talk about sex versus intimacy versus sexuality, sex does not require intimacy. It is a physical act only. Yes, you may have sex with somebody you have an intimate relationship with, but sex itself does not have to require intimacy. In fact, there are multiple facets where it does not have any intimacy at all involved. So, just for definition purposes, sex is physical. Intimacy is that feeling of closeness, emotionally, physically. It can also be cognitively. And then that sexuality is who you are as a sexual being, how you see and express yourself. And so you can see how those words sometimes get used interchangeably, but mean different things. So this is where I have the video, because I wanted to talk more about how desire occurs in women. There have been multiple models where this has been laid out, and for a lot of people, they model it kind of like a straight line, but it's more complicated than that, which is why I love this model and why I included this one, because there's a lot of different parts around it. In the middle, you see somebody develops spontaneous sexual drive or hunger, and if you follow the arrow on top, it says it motivates a sexually neutral woman. So a woman who was not turned on or into having sex before this, something occurs that that turns them on. And then there's sexual stimuli that can encourage their response, which leads to sexual arousal, and then arousal and desire, and then emotional and physical satisfaction and emotional intimacy. So as you all know, cancer absolutely has an impact on sexuality and intimacy. It can cause a decreased libido, decreased ability to orgasm. A lot of times, if you weren't already in menopause when you got the cancer diagnosis, treatment has put you into menopause, or surgery has put you into menopause, or you were already in menopause and now you're on an anti-estrogen pill that is just kind of wreaking havoc on all of your body parts that are supposed to thrive with estrogen. It can also cause a change in self and body image. You know, our breast cancer patients feel this a lot because of the impact to their breast when they have surgery, radiation, chemotherapy. I know that our breast oncologists as a whole do a fantastic job at talking about the changes in sensation that may occur, but oftentimes it doesn't really resonate exactly what that means until after it's happened. And I've seen multiple patients who will bring it up and they'll say, I absolutely was warned about it, but I just didn't conceptualize what that actually meant for me. Or I didn't realize how much my breasts were a part of my sex life. And now they're on the other side of their cancer diagnosis and everything has changed. So it is a common occurrence. I know there are no vulvar cancer patients here, but when we do surgery on that area, we also cause body image changes. And so cancer is just not gentle to us. We also cause a possible decrease in blood flow to the genitals after radiation. So again, talking about more of the lower half cancers, they get radiated a lot and there is no clitoris shield. So for men, for penis owners, there is actually a shield that protects their penis from radiation when they get it. They don't have one for women currently or vulva owners. So there's nothing to shield the clitoris from radiation. Obviously, our radiation oncologists do their best not to direct the radiation to that area, but oftentimes it's collateral damage. With radiation to the breast, that changes blood flow as well, and that causes scar tissue. I saw a patient today who's 2.5 years out from her breast cancer treatment, and she still has incredible pain underneath her cancer affected boob whenever her breast is manipulated. So if she's just sitting there, it is completely fine. But she could be in the middle of trying to be intimate with her husband. And if his hand slides just a little too far up her ribs, her entire body tenses with pain because she has scar tissue there that's painful. Persistent fatigue. Again, cancer is not gentle on our bodies. It also can cause persistent pain from scar tissue and various other, surgeries and radiation. There's a lot. There's an uphill battle when it comes to cancer and then sexuality and intimacy after cancer. So, how do you discuss this with your provider? If your provider has never brought this up, how do you bring it up? They have done studies, and one of the things that I try to do is encourage providers to bring it up regularly, even if you don't have an answer. I think that's why a lot of providers themselves don't bring up sexual health with patients, because if they ask and then the patient complains about something and they don't know what to recommend or they don't have any resources, what do they do? Why did they ask, right? So it's helped my providers, my other providers in my office and in the surrounding area feel more comfortable asking their patients, because then if they don't know the answer, they can say, well, guess what? We have an oncology sexual health clinic, and Nicole can help you and take care of you. So if your provider is not asking those questions, I want you to feel empowered too. It is your life, right? You got put through all of this cancer treatment so you could live your life. And this is part of it. Whether or not, it has been a big part of it is certainly individualized, but intimacy and sex in general is a very big part of life. Even if you're not partnered, it can be a big part of, sex can be still a big part of your life. Intimacy with other people is still important. So if you find that you are having issues, it's not a bad idea to discuss with your provider. Now, who do you talk to is probably a harder question to answer. Family doctors or family practitioners may be able to help. You can also talk to your gynecologist if you have one, but your oncologist may have the best resources for you, because chances are, if you are feeling the way you feel, it's probably something that they know those treatments cause, and they may be more well equipped to help you deal with those side effects. So if you feel shy or uncomfortable, just know there's no rules for why you ask a question. You don't have to elaborate. You can simply just ask a question and ask and wait for an answer. Oftentimes, at least I will do it if I feel nervous. I will start to try to reason out loud why I'm asking something or why I'm doing something. And it's not necessary. All you have to say is, hey, do you have any suggestions for vaginal dryness? Or, I don't really have vaginal dryness, but on the outside it's a little bit sore and tender. Do you have any suggestions? So there's never any shame. There are body parts. So I know that we think of every other word imaginable for penis and vagina, and I'm sure you can think of a couple that are really out there that you've heard. But really, they're just like our elbows. They're our body parts, and so talking about them is only going to make you more comfortable with who you are and help, potentially improve things that you've been struggling with. You don't need to have a medical issue. Sex doesn't have to hurt for you to bring it up. If you feel like your sensation has changed, well, yeah, that's not a medical issue per se, but it's something that's different for you and impacts how you experience it. And so, absolutely, it is a valid question to ask. Sorry. You can ask how to increase your pleasure. So I know I'm not talking about that necessarily today, but a lot of vulva owners don't necessarily understand that their clitoris is where all of those nerves are. And again, because we don't even talk about the clitoris in anatomy and sex ed when you're in elementary school, middle school, high school, they have no idea unless they've learned from another source. And so asking how you can enjoy sex more, asking how you can increase your pleasure, there's nothing wrong with those things. You are entitled to pleasure. You're more than entitled to pleasure. You've been through so much with your cancer diagnosis. So these are absolutely things that, if your provider is not asking you, you should absolutely advocate for yourself. There's nothing wrong with wanting to enjoy sex. It is not dirty. Um, if men are allowed to enjoy sex, so are women. And so I want you to make sure you feel empowered to ask those questions, even if it feels a little tough. You can also focus on your emotions. You can talk about how it makes you feel. That's something that can be helpful, especially if you're working out communication. That's more for maybe a counselor or a therapist, but it's still a valid thing that you can talk about with a healthcare provider who could help you. There are no rules to how you ask either. So you don't necessarily have to come up with a scientific question. You can just say, I'm having pain with sex, or I'm having dryness with sex. I'm not having it as often as I'd like. My dryness is really affecting my sex life. I want to have an orgasm, or I've never had an orgasm. What can I do? How can I regain sexual pleasure? I have a low sex drive. What can I do? So they can be very direct, but they can also be broad, and it depends on your comfort with your healthcare provider. But these are absolutely things that you are entitled to ask and should if you are having these difficulties.
Nicole, I just want to interject for a moment, because I love, if you can go back to the slide, some of the suggestions for starting this conversation. We're seeing a lot in the chat that for many of our attendees that are here, they have not had these conversations with their provider, or they haven't gotten good answers. You know, one provider might just tell them to use lube, or no one else brings it up in discussions that this is something they may experience. Certainly we have one member with us that has had a very vocal provider, but for those that haven't, or, you know, and this is a new topic for them, I think these bullets on how to get that conversation started can be so helpful.
Absolutely.
Great.
Sorry, since I'm sharing my screen, I can't see the chat. So I promise I'm not ignoring you all when you're answering or, piping in. I absolutely want to hear your experiences, and I promise I will read them. They're just two different screens, and so I can't see the chat unless I go look for it. And then I lose my slides. And we know how that goes. So, yeah, I think talking is important. Talk to everybody, right? Talk to your friends, talk to your partner, talk to your healthcare provider. If the healthcare provider you're seeing doesn't give you adequate answers, talk to another one, right? If you're seeing one oncologist, but you also happen to see their PA or their nurse practitioner, and say one of them doesn't give you the right answer, or not the right answer, one of them doesn't answer, you feel blown off, you can always ask the other one. You can also always ask about another specialty. Like I said, gynecology sometimes can help, but also so can family medicine. And if not, they may be able to direct you. But it is not helpful when somebody just says, oh, we'll use lube. Okay. Well, one of the first things I will ask my patients when they come into a visit with me is, what kind of lubricant are you using? And they all stare at me because nobody knows there are different types of lubricant. They work differently, they last different amounts of time. And so if you don't know that and you just walk into a store to buy it, you don't know what you're buying. Maybe you just pick the cheapest one because you spend a lot of money on a lot of other stuff and you just, okay, let's grab this one. Or maybe you like the color of one, but unless you really, or you've heard of the name, but unless you really know what they're made of and what's in there and how they work, it makes it really difficult to be successful in a short period of time. It definitely extends the amount of time it takes you to figure out what is going to work for you. So thank you for that interruption. That was perfect. Communication is key. That's why it was capitalized in that earlier slide. Making time to discuss with your partner. Use feeling statements and words. A lot of times, as humans as a whole, we assume that other people know what our intentions are and other people know how we're feeling. And we do this, we do it for ourselves too. We assume that we know how somebody else is feeling, or we assume what somebody else's intentions are. But unless you verbalize those things, you really don't know. You're making an educated guess probably on what you know about that person. But if you're, I used this earlier. If you are, sorry, my 7-year-old's trying to come out back. If you are trying to, you're unloading the dishwasher. Every time it gets run, you're unloading it. Nobody else ever touches it, but nobody says anything. That gets really annoying after a while. You're like, everybody else eats here. I am doing the dishes constantly. Nobody else is doing this. But if your partner says, oh, thank you for doing that. It's the worst chore. I absolutely hate it. I will do X, Y, and Z instead. That makes you feel better about doing it, because maybe it's not your favorite chore either, but at least it's being acknowledged and they're offering to reciprocate in some way. And so communication is key. And I think a lot of times we take that for granted as humans in general with any relationship. We think that we know what the other person is feeling, or we perceive it a certain way, whether it's good or bad, and we kind of hang on to that. And that's, well, she had to be mad because she said it this way, even though maybe she never said she was mad. And text messages and virtual stuff definitely gets more complicated with that. But communication is key. Reflective listening. So I don't know if you've all seen the meme where it's got two pictures side by side. On the left one is water coming down to a brick and there's a puddle around it. And it says listening to respond, meaning somebody's listening just so they can argue back with you. And then the other one is water coming down into a sponge and the sponge is just getting bigger. And it says listening to understand. So there is a difference. Reflective listening helps because when your partner brings up a issue or topic, kind of repeating back what they say to them a little bit. I know that can sound annoying sometimes, especially if you're mad and people do it to you. What I hear you saying is, but it actually cuts out a lot of confusion, because you repeat it back. And if you repeat it back in the way you took it, which is not the way they meant it, they have time to correct it versus you just internalizing, oh, that was offensive, or, however you take the conversation. So communication is definitely the thing that is the biggest part of intimacy and building it and getting it back, especially after a cancer diagnosis. Your partner, chances are, will never understand what you've been through, at least to the point where you understand it. They'll never know what it's like to be in your body. They'll never know what it's like if your vagina is sore and dry. They'll never know what it feels like not to feel your breast. So, or have pain if it's touched. And so communicating those things is really important. Explore your sexuality. I know this can be a little bit of a controversial topic, but masturbation really helps. And again, I know it's something that is never talked about. And if you ask most penis owners, they mostly don't think women do this anyway. But it helps. It helps feel good. Or it feels good. It does help with your overall health. It reduces stress. It helps you sleep better. It improves your desire, believe it or not, because if you have been having painful experiences with sex, we'll say, because pain is the most common thing too. If you're having painful experiences with sex and haven't found an intervention that helps and you just keep doing it, of course your libido is going to be low. Of course you're not going to want to have sex because it hurts. It's not good for you. You want to do it because you love your partner and you want to make your partner happy, but you don't want to do it because it feels like a chore and it also causes you pain. So exploring your own sexuality and masturbating can help improve your desire for your partner indirectly because it can help build those positive memories of sexual experiences. It also can help improve your self-esteem and body image. I know that doesn't sound plausible, but I promise it's been studied. The one thing that I forgot to mention too is if you don't know what you like, how are you going to communicate that to your partner? So if you're somebody who's never masturbated before, there may be things that you're missing out on. And so it's not a bad idea to get to know your body, especially the gynecologic cancer patients, because their vaginas get so medicalized. Their whole pelvis is medicalized. And then we send them on their way, right? And sometimes we give them these big dilators that are giant and they're really hard plastic. You could probably beat an intruder with them and win. And we say, here, this is to help dilate your vagina to keep it open. And good luck. So, because everything's been so medicalized, a lot of times the easiest way to kind of dip your toe back into intimacy is to get to know yourself better first. Treat pain. So if you are having pain, yes, lubricants can help. Moisturizers can help. I'm not just listing these because I know I just blasted physicians for just saying lubricants. There are additional actually answers on later slides that will give you types of lubricants and names and things. But these are all things that we can do to treat pain. And not all of them, I know, especially in the breast cancer community, a lot of people see the word estrogen and have a little bit of a panic attack. We'll talk about that. But these are all possibilities. And so you're not alone. You're not the only one. You're not broken either. You're not something to be fixed. You had cancer, and we are just trying to get you back to enjoying yourself, enjoying life. So I actually that one's small. So I'll bring this one up. So these are some lubricants and moisturizers. Like I alluded to, there are 3 different types of moisturizer or lubricants. There's water-based, and those are all listed there. There's way more than that as well, but that's just a list of the most popular ones. Water-based is probably the most common one you'll find. So if you were to walk into a grocery store or a pharmacy and go into the family planning section, water-based is probably about 70 to 75% of what's on those shelves. It is a couple dollars cheaper. The problem is if you have any kind of vaginal dryness, often the water-based lubricant absorbs into your tissue. So either that means you never feel like you have lubricant on, even if you dump the whole bottle, or you feel okay for a little while and then that gets reabsorbed into your tissue and it doesn't feel so great anymore because it's gone now. There's silicone-based lube, which is in that middle column. It's the top spot. Silicone-based lube works fantastically for cancer patients because it does not absorb into your tissue. It is easy enough to wash off. It's better than oil-based, which is below. And there are ones that don't have additives in them. So Uber Lube, that's second from the bottom on the silicone one, that's my go-to for patients that I recommend because it doesn't have parabens, it doesn't have glycerin, and for all you interested, it's gluten-free. So that makes life easier for a lot of folks. There's also below that oil-based lubricant. Again, that can be more difficult to wash off, and it may cause bacterial or yeast infections in people who are more prone to getting those. And so I have people that use oil-based lubricants or coconut oil, and they absolutely love them. They would never do anything different, and that is fine. But I've stopped recommending it as a first thing to try just because of the infection risk. Now, moisturizers, on the other hand, are more like lotion for your skin, but for your vagina. So this is how I tell my patients to remember. Lube is for love and moisturizers for maintenance. So the moisturizers you can use anywhere. You can use them once a week. You can use them 7 days a week if you'd like. They're non-hormonal, but they essentially are a vagina-friendly lotion that you can insert. You can rub along the outside if you need to, and it actually does penetrate that tissue a little to make it more moist and to make it stretchier. It's not as good as estrogen, and we will talk about estrogen, but it does work well for a lot of people. And so I would say Replens and Reverie are big ones. The Hyalo GYN, which is that bottom one in the moisturizer column, that one was actually created for breast cancer patients. So what I would say with moisturizers is hyaluronic acid, and I can write the name of that in the chat at the end. Hyaluronic acid is the key ingredient because that's actually, they have it in face moisturizer too. I know it doesn't sound intuitive to put something that says acid in your vagina, but I promise it is tested and is safe. And it actually penetrates the tissue better. So vaginal estrogen. Again, I know the E word is a bad word sometimes. Vaginal estrogen has been robustly studied in breast cancer patients. When they've studied it, they've done multiple different kinds of studies. One of the studies was they drew a woman's blood work, her estrogen level in her blood prior to using the therapy, and then drew it periodically over the time that she was using the therapy. So if using the initial use of the therapy caused the estrogen level to rise a little, that resolved by 12 weeks. In most people, it didn't resolve, but if it did, it would resolve over that first 3 months of use. In the 7 studies that were performed of over 4,000 breast cancer patients, and they followed up with them anywhere from 2 to 7 years after the study, there were no increased risk of breast cancer associated with vaginal estrogen use. They studied both estrogen positive patients and estrogen negative patients, and in neither group did it show an increased risk of recurrence. In about 6,000 patients, about 5% used vaginal estrogen in a second study, and they followed those patients, no increased risk. And then at the bottom, the second one was published this year in JAMA. The bottom one was published last year by Dr. Agrawal. She's a medical oncologist who takes care of breast patients, and she is fabulous. She did a study of over 42,000 women with genitourinary syndrome of menopause, which is essentially vaginal dryness, vulvar dryness, irritation, pain. It may include urinary issues like frequency or leakage. And so she followed 42,000 people with that, and they also had breast cancer. 5%, again, got vaginal estrogen, and there was no increased risk of recurrence. So I hope this helps you feel a little bit more comfortable if that's the route you have to go. But it really has been proven to be a safe drug to help with vaginal dryness and genitourinary syndrome of menopause. But a smaller name for that would be nice. DHEA is that long name that I'm not even going to try to pronounce because I can guarantee you it's almost like Dreibelbis. It's even worse. So the FDA approved this for women or vulva owners who have genitourinary syndrome of menopause, GSM. It does significantly improve symptoms and dyspareunia, which is pain with sex. There's no significant elevation of hormone levels, but safety in breast cancer is controversial because DHEA can be converted to estrogen. And so this is not as well studied. So I would say, especially for our breast cancer patients that are on, this is likely not going to be recommended to you. And that's okay. Honestly, between the two, estrogen is tried and true and very proven. And so you could be fine either way. But with this being uncertain in breast cancer patients, vaginal estrogen would be more what I'd recommend for you. Dilator therapy, I know I briefly talked about the big white plastic stick. The ones that are pictured here are slightly different. They are soft, they're silicone, they flex a little bit. And so sometimes, especially with vaginal pain or scarring, these can be helpful for patients to very gently increase their diameter of their vagina in order to accommodate an exam or intercourse. Oftentimes we will have patients use these after radiation to the pelvis specifically, but there are lots of women, and I've taken care of some of them, who don't actually even have a cancer history, and just going into menopause caused them to have some vaginal atrophy and some stenosis or scar tissue and shrinkage of their vagina. Physical therapy, pelvic floor physical therapy, if you have not heard of it, is becoming more and more popular. And honestly, I think it's one of the most fantastic things. Pelvic floor physical therapy are groups of physical therapists who then go on for more training to learn how to take care of the pelvic floor. I was able to follow one around for a little while, and honestly, I was just amazed. They teach patients how to identify their pelvic floor muscles, and they can do different things to work up whether or not you're too tight or too loose. So if the muscles are too loose, you may have things like urinary leakage. You may feel like your pelvic organs are kind of dropping a little bit into your vagina. If you have muscles that are too tight, you may have painful sex, or you may have had painful sex and that has kind of led to a hypertonic or always tight pelvic floor. So there's a lot that impacts the pelvic floor, and the pelvic floor impacts a lot. So there are patients who will have back pain, but really it's a pelvic floor problem. And it's all intertwined, which is why going to a physical therapist who specializes in pelvic floor is wonderful, because they specialize in all of it. They do head to toe and the pelvis. And they're just fantastic people to work with. So as far as overall recommendations for improving intimacy, a good night's sleep is always the key to everything. And I know that gets interrupted a lot as you go through menopause, have hot flashes, or cancer therapy that causes menopause, that causes hot flashes. There's a lot of things that can interrupt your good night's sleep. So trying to get a good night's sleep is helpful. Exercise is helpful. It helps you feel better about your body, but it also is better for your heart. It's better for your brain. It's better for your stress levels. And the less stressed you are, the more likely you are to want to have sex. Mindfulness, right? Taking that time, doing the breathing exercises, being in tune with your body. Those are all helpful things. Sensate focus. So that is a tool that a lot of sex counselors and therapists will use in patients who either have trauma or pain with penetrative sex. Sensate focus is where you kind of slowly start to build the intimacy. So, for example, the very first time a couple does this, they're completely dressed. They're just touching each other, maybe kissing, but no genital touching. And then the second time they go to do this, maybe they're naked, but still no genital touching. And then the third time they do this, maybe we're finally touching the genitals, but there's no penetration. And it kind of helps with people who have been consistently impacted in a negative way by sex. It helps them start to build confidence and trust in their partner again, and help regain some of that and we're going to say confidence again, but regain some of that confidence in how things are functioning with their partner to continue to proceed each time they go back and try and replicate this. Pre-medicate. there's nothing wrong with taking a couple ibuprofen ahead of time. Or if you have chronic pain, if you're on oxycodone or whatever you're on, it is okay to take that before sex. If you know that, if you take it for joint pain, it may be a good idea to take it before you're in positions where your joints maybe haven't been for a while. And so not a bad thing at all. Vibrators are great. I recommend everybody get one or multiple. And Amazon has them for relatively cheap, and they're pretty effective. So with the decreased genital sensation from menopause, from cancer therapies, it can be harder for vulva owners to orgasm. And so vibrators are really helpful with that. So oftentimes I will pull up Google, I will type in vibrators and look at the pictures, and I will talk to my patients about how each individual type of vibrator works. And we'll talk about what they think might be best for them. If you are shopping for a vibrator on Amazon, usually what I tell patients is look for something that's 4 stars at least, and look for something that has at least 1,000 reviews, because I can promise you people are very generous with their Amazon reviews of their sex toys. One of the most popular ones I pull up has over 37,000 reviews. So if you can't find one that has over 1,000, don't buy it, because it's not studied enough by our Amazon folks. And then lidocaine, right? Especially for pain externally. If there is, if you have scar tissue from a previous episiotomy or from a surgery or radiation, lidocaine in specific areas in low doses can really be helpful to numb that pain or decrease that nerve sensation. You wouldn't use it everywhere because you don't want to numb everything, but that's where it's helpful in specific spots. Okay, so mindfulness is intentionally focusing on your thoughts. Breathing exercises and meditation, there are apps for that, and a lot of them are free. Sensate Focus was developed by Masters and Johnson. So those were the people I talked about who were the original sex researchers. It helps couples connect without the pressure of sexual performance because you take penetrative sex off the table. It includes touch, massage, exploring different sensations. I often tell my patients to do some version of this when they first return to having some kind of sexual encounter with their partners after they've seen me for the first time. Okay, so that's all I have.
That was wonderful. We've had
Perfect.
so much engagement. Yeah, we've had so much engagement. So we'll give you a moment to look through the chat, Nicole. But going back to a little bit that you mentioned about pelvic floor, Tracy was wondering, how did they find a pelvic floor physical therapist? So is there a society or like a national organization, because we have members across the country, where they can find someone in their area?
There are societies for everything. So I would be willing to bet that there's a society for pelvic floor PTs. And I don't know it off the top of my head, but that is the beauty of having cell phones where you can look up everything.
Yeah.
And so how we actually, the institution I'm with, we are paired with a physical therapy group, and they have a select few within their group that are trained to do pelvic floor PT. So when we send a referral over, and actually they are prostate cancer patients also go there for pelvic floor physical therapy after they've had their prostates removed. So they deal with both penis owners and vulva owners all the time. But I will see if I can find that for you. I know there is some kind of professional society where you can find it. So I will look into that.
No, Erin, for us too, we were going to put it in the chat. We actually did do a yoga for pelvic floor. It's in our library in there, and Ask the Expert, so she can take a look, or I'm sorry, not she, the community that's on can take a look and see if that could even give you a nice introduction. So you're thinking about what you may want to dive into. And I know Erin was going to put that in the chat. Perfect.
So
Yeah.
I found something. That's why this is great. Okay,
Go for it.
so I will put it in the chat. It's called the Academy of the American Physical Therapy Association, and they have a pelvic health group where you can actually look up a specific pelvic health specialist. So I will get that to you all. I'm just going to type it in here and then I'll get it in the chat.
Wonderful.
Yeah.
And we had a lot of sharing of different products that our members use based on their experience or what was recommended from their own practitioners. So I love that our community here is just sort of, you know, giving what we've learned, because, you know, as we've heard, not everyone has such open conversations. So certainly feel free to look through that as well.
Yeah. And, you know, if you call in and you talk to the receptionist and you say, I need pelvic floor physical therapy, and they don't acknowledge that that is a separate thing, they might not have them. And sometimes the receptionist specifically, because that's who you schedule with, they don't know that that's a thing. So if you are calling yourself, I would absolutely ask and say, do you have people who specialize in pelvic floor physical therapy? Because if you just say, I'm scheduling pelvic floor PT, oftentimes they just hear PT and they don't really question it. I've had patients come back to me and say, I don't think that was the right person, when I try to send them closer to their homes, which is, you know, we serve people in a large location base. So we have some patients who travel 2 hours to come see us. So obviously not for pelvic floor PT, we'll try and get them up closer to home. And sometimes they've come back and gone, I don't think that person was specialized in that.
Yeah. I do have a
Uh,
question for you, Nicole. Also, someone had messaged privately, and I'm wondering if this is where they could also be referred to pelvic floor, just some uncomfortableness with intimacy and intercourse, and sort of feeling some pain with that, feeling like there's a lot of pressure in the back. So that sort of experience may be worth exploring with a physical therapist, a pelvic floor physical therapist. What would your thoughts be?
yeah, absolutely. So um, there's a couple different things that it could be, but I would absolutely refer someone who came to see me with those complaints to pelvic floor physical therapy, because even if it's not directly related, I'm sorry if you can hear the airplane, even if it's not directly related, it's probably partially related. And so it never hurts to get a pelvic floor PT. The other thing that sometimes happens after menopause or after a hysterectomy is how vulva owners lubricate themselves changes. So there are two different ways that the vagina lubricates itself. At the opening of the vagina, there are two glands that produce some lubricant. And so a lot of times when people say they feel wet, that's what they're feeling, those Bartholin glands producing lubricant. Further up into the vagina, there are no glands like that. The only thing that produces lubricant further up into the vagina is the cervix. And so if you don't have a cervix because you've had a hysterectomy, or if you're in menopause, that discharge is no longer there, right? And so that was all of your internal lubrication. So a lot of times patients will have deep pelvic pain and they don't describe it as dryness because it doesn't feel that way to them, but truly that's what it is. And so sometimes getting lubricant up into the vagina can be helpful there. Um, it is difficult to get lubricant up in the vagina. So if any of you have ever um, used Monostat, or I'm trying to pull it up now, but they have those clear medication applicators that they come with. You can fill those with lubricant and get them further up into your vagina. And that's a little bit more helpful. So let me see if I can pull up a picture and I can share. Now this one's like $27, which is silly expensive, but it's just the first one I found. So don't buy this one. But if you're trying to get lubricant further up into your vagina, it kind of is like a tampon applicator, but you can pull back that piston, fill the inside of it with lubricant, and then get it up higher into your vagina so that it can get where it needs to go. Because you can put some on the outside, but it's not necessarily guaranteed to get all the way up to where you potentially need it. So twofold, I would have that person try this, but I'd also go to a pelvic floor PT for sure.
And all of the lubricants that you mentioned in that chart, that's all things that can be purchased on Amazon or in a local pharmacy or something like that. We don't need a prescription for those.
Correct.
Okay.
Correct. And I can share that screen again because I just pulled it back up. But Yes, you don't need a prescription for lubricant. The estrogen or the DHEA are the only two things you would need a prescription for.
Got it.
I know we have one from Susan as well. She was just talking about burning after urination.
Yeah,
After intimate relationship, is that normal and can that be helped?
it absolutely
The
can be
pain is
helped.
after
So
the fact. Hmm.
I'm assuming it's external burning, and it's probably from friction.
Friction.
So the things that nobody tells us about vulvas and vaginas is that when you go through menopause, everything shrinks. So prior to menopause, the mucosa or the moist part of the vagina actually sticks out of the vagina a little bit. So when you have sex, it's moisturizing that penis already, right? As we go through menopause, it all shrinks. When it doesn't have estrogen anymore, it all shrinks back and now it's just skin. So you essentially have like a web of skin there, and between his penis and your skin, neither thing is lubricated. So you end up getting these micro tears and not, or bleeding even. So
Mhm.
concentrating the lubricant at the opening down here for your vagina is helpful. Also on whatever side of the penis is going to be rubbing that. So let's say you're in missionary position, right? You're going to put it on the bottom of you and then you'll put it on the bottom of his penis so that the lubricant is rubbing itself, and it's not skin versus skin, and that may help cut down on that burning after, because I'd be willing to bet you're just getting a whole bunch of micro tears.
Yeah, and the moisturizing is so key. Like I know I had seen such a difference just by moisturizing regularly. I never thought like, oh, I should be doing that. And that does even make a change in that burning after sexual intercourse. So
Absolutely, because that helps
just a thought
build up
there.
that tissue.
Yeah.
Yeah.
And then those applicators too, I put it in the chat, but Good Clean Love has applicators that come with their actual moisturizer and their lubricant. So they have one and then you just sort of hold on to it. So if you purchase that actual um, product,
If you
you'll
buy
have
any of
one.
the moisturizers, all of the moisturizers should have it.
Yeah.
And if you get prescribed vaginal estrogen, it should also come with it at the pharmacy. It's just if you're trying to buy it for yourself randomly, you have to kind of Google it or looking on Amazon for it.
Yeah. Good Clean Love used to be in our care boxes. So we actually are getting them to come on back. So they were a good resource that we've
They're
used a
great.
lot of. I'll put the website is just Good Clean Love, but I'll put the link in here.
Wonderful. And I had one more question, Nicole, just kind of related to intimacy and sort of creating that, physical sensation. I had another attendee message me asking if you, as an expert in this space, know of resources to help women who ended up flat, not by choice, and are having body issues around that, keeping them from wanting to be seen or touched in the chest area, which is so difficult. So wondering if you could just share any resources you may know about.
I don't, but if I can reach out to colleagues, because I have lots of breast cancer friends, who work in the field, if I can reach out to them and I let you all know, could you just share it widely with whoever registered for this?
Absolutely. Yeah, you can
Okay.
send it directly to me and I'll pass it along for sure.
Okay, great. I'm gonna put it in my phone now so I don't forget to ask. But I already know who I'm gonna bug about that, and then I'll get back to you. I promise.
Wonderful. Thank you.
Hmm.
Thank you. Thank you. Okay. Any last questions? I know we are at time.
I saw Shauna had a question, and my thought
Yeah.
there, Shauna, is that we do have, if you are an active passport user, um, that we do have a sexual health counselor that might be able to help you with that. Her name is Dr. Sabita Pilia Friedman. She's on our provider list. If not, she is actually a sexual health counselor, and you can call and see what her rates are. But that may just get you to get started with some ways to think of some solutions. It's been very helpful for us to be able to use the passport for sexual health consultations and counseling. So that may help you there. Again, it's Dr. Sabitha. I will put it in the chat. Um, and then I feel like on that same note, there was another comment that just talked about just having a lot of trouble with intimacy. And again, a sexual health counselor may just get you started, you know, and feel like you can move forward instead of feeling stuck.
Yeah. Yeah, they're a great resource. And there are not a lot of them.
They're not.
But ASECT is a website for that, and I can get that as well if you want. ASECT is the American Academy of Sex Educators, Counselors, and Therapists. I always pause
Correct.
when I have to say it
Yeah.
out loud.
Oh, what a great resource. That's great.
Yeah. And on our provider list, we actually have that acronym next to the counselors that have that degree so that you know
Perfect.
that. Yeah.
Wonderful. Okay, anything else before we wrap for this evening? I know you can clearly see Nicole is really an expert, so well versed in all of this. So any other final questions for Nicole? Oh, you're so welcome.
This was
So the
great. I
chat
loved it.
conversations, you know, Erin, sometimes we download the chat and actually, I know there's a lot of resources on the chat. Maybe you should take some screenshots if you want them right now. Sometimes we do download the chat and put it with the posting. I don't know if we're going to be doing that, Erin, but we had somebody saying, you know, can we get the chat? And most
Yeah,
likely
we
it's
can
because
pull.
there's just so many links.
Yeah, absolutely. I'll go through and pull the different resources and links that Nicole is sharing that others have shared as well.
And then we can make a document and put it up on the virtual Hangout.
Yes. Yep.
Perfect. Nicole, it was great. Thank you.
Oh, this was wonderful. Thank you so much for having me.
You got it.
Thank you
got
so
it.
much, Nicole. Yeah. All right. Perfect. Sue, I think we
All
will.
right. Yeah, another one done, Erin. It's always such a good topic. I just feel like I
Oh
can
my
breathe
gosh.
better when I listen to so many solutions, because there shouldn't be a reason why you're not able to get some of these resources easily, right? And I'm so glad that you bring it forward to us in this very easy conversation, which we did have comments in the chat about how easy it is and straightforward, and that's how it has to be talked about, right? So very, very good. Thank you, Nicole.
Oh, you're so
I
Absolutely.
think
welcome.
Erin, yeah, go ahead, Erin.
I was going to say, and great tools to get that conversation started with your provider. So I love that there's some takeaways because it's not always easy, as we know. So hopefully
Yeah.
that gave you a pathway to start that conversation.
Yeah. So at this time, we want to thank our sponsors once again. We're so grateful for them. And our presenting sponsors are West, Merck, Daiichi Sankyo, and we get additional support from GSK, Lilly, Gilead, Pfizer, and then Immunogen, which is a part of AbbVie now. And Erin,